Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness. We sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. But before we dive into our discussions, let's take a moment to appreciate the tradition of tea time. Originating in England during the 19th century, tea time became a cherished ritual for British society. And speaking of British traditions, our very own Dr. Leah Merle is a British expat who now resides in the USA. She brings with her not only her expertise in mental health, but also a deep appreciation for the therapeutic power of tea time. So grab your favourite cuppa and get ready to sleep yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more compassionate world.
Hello, welcome to Tea with the Experts. I'm Dr. Leah Merle, and today we're delving into the topic of trauma. Joining us today in an interview is Lorencita Villegas, and she is a licensed mental health counselor from Washington State, as well as an approved state supervisor. Lorencita is a psychotherapist with a private practice in downtown Seattle. She's also a counselor educator at Antioch University in Seattle, and the classes she teaches tend to be introduction to trauma, case consultation, as well as internship and practicum. She's also created a 4-class graduate certificate in counseling Latinx after noticing a higher need in educating students in how to better approach treatment in this growing population. Lorencita specializes in trauma treatment, and she's also certified in EMDR, as well as neurofeedback within her practice in Seattle. So welcome to the show, Lorencita. Thank you so much for being here. It's such a pleasure to have you here today.
Of course. Thank you for having me. It's a pleasure to be here.
Wonderful. Well, I'm going to dive right into our first question today. So, of course, trauma in our field is a big area. We talk about it continuously. And many people specialize in trauma, but one thing that I love about your practice is you've been doing this right from the beginning of your career. So my first question is, can you start by telling us a little bit about your background and really what led you to become a mental health counselor specializing specifically in trauma?
Yeah. So I was born and raised in Colombia. And I moved to the U.S. for college. And, like any other college student, I myself had no idea what I wanted to major in. And after taking a few classes at school, I went to, an advisor, and he had me take some testing. And I scored really high on empathy and helping. And then he suggested, why not taking a few more psychology classes? So I did, and I was kind of like fascinated by it and just decided to major in, have a bachelor's in psychology, and I have a minor in sociology. And then after that, I got a master's in counseling and specialized in EMDR and neurofeedback. And the way that I kind of got into trauma, it was actually when I was doing my internship. I did my internship at a methadone clinic. So I have to be there really early in the morning, like 3 o'clock in the morning, for folks to doze, do groups, do counseling, and then go on to their jobs, right? So, and working with addiction, I just saw, you know, the roots of trauma, right? And I will go to my professor in internship and kind of describe to him what I was seeing. And he started to kind of tell me about trauma. So I graduated in 2009, 2010, and my program did not have a trauma class, right? So this is how far we have come, right?
Wow.
There was not a trauma class. So this professor kind of took me under his wing and started to tell me about trauma. And he was the one that kind of planted the seed that, all humans experience trauma from any developmental stage that they might find themselves in, right? It's like it just changes, right? So then he introduced me to EMDR, and I was fascinated just by him describing the treatment itself. So right after I graduated, then I immediately got trained in EMDR. So I've been trained in EMDR since 2010 and been utilizing it since then.
That's so incredible that you've been doing EMDR for that long, right? Because it is an evidence-based treatment in the trauma field. And so you've obviously treated many people with that intervention.
Absolutely. And then in 2016, I got trained in neurofeedback and also have incorporated that into my practice. So those are the two modalities that I use primarily in my practice. So what a session might look like for me is you come in and we do a 15-minute neurofeedback training to, calm the brain and get ready to do some heavy processing on trauma with EMDR.
And then maybe we could start with, for our listeners that are not familiar with the term trauma. I mean, most people know the term, but how would you define it specifically?
Yeah. The way that I define it is trauma is an emotional response to a terrible event that you were unprepared for. So you don't have the coping mechanisms to help you get out of it, or the coping mechanisms that you have are not enough to help you balance that emotional.
Yeah, that's beautifully said, because really it's so simplistic, but yet it's so complicated on the inside, right? When people go through different types of trauma. And so can you explain the difference between acute trauma, chronic trauma, and complex trauma?
So when we talk about acute trauma is brief, intense, and potentially devastating incident that can overwhelm your body's nervous system. So it can be a single event, for example, like a car accident. So that is acute. Now, when we talk about chronic trauma, so chronic trauma refers to trauma that has occurred following a series of events. Unlike acute trauma, which is like a single event, chronic trauma, these events have happened multiple times and include experiences like prolonged child abuse, prolonged, war. So we see this in combat soldiers, and repeat sexual abuse. And then we have complex trauma. So complex trauma is defined as exposure to multiple traumatic events that occur early in life, right? So often within the context of interpersonal relationships. So these events can be very pervasive, such as abuse, neglect, interpersonal violence, community violence, racism, discrimination, and war.
Beautiful explanation. And so it's a huge spectrum, and there are differentiations between the three. I'm wondering about common causes of trauma. Are there common causes, and are there specific events or experiences that are more likely to lead to traumatic responses? And you've already mentioned a few there.
Yeah. So again, we need to be really aware and mindful that trauma, it's individual, right? So what an event that might be traumatic for you might not have the same effect on me, right? So let's take, for example, a car accident, right? You were in a car accident and you become extremely fearful of just being in a car, right? Because those memories become really intrusive and you think about the incident, right? And for me, I might have, been in a very similar car accident and I don't have those reactions, right? So it's very individualistic. So it's not that I can say like these specific things will cause trauma, right? Because it just really depends on the individual and the individual support system, the individual's ability to cope. And we know that coping is something that we start very early on in life.
Yes, early, really those formative years, very, very early in childhood. And you touched on kind of early childhood experiences as well. And that's going to be a separate episode when I dig into ACEs and the ACEs study. But there's some really profound statistics and information that kind of comes out of that study as well, and we utilize in the field. I'm wondering about the individuality that you're talking about, the real impact of trauma. But in your perspective, in your experience, how has trauma impacted the individual that you've been working with, their mental as well as physical health in short term, and then also maybe in the long term? What have you seen? What's your experience?
Yeah, so if we focus on short term, again, it goes back to acute, right? So this event happened, for example, a messy breakup, a divorce, something that you were maybe not prepared for. Maybe things weren't as good as you thought, and then there's a break, right? So then that in the short term and potentially in the long term can affect someone's self-esteem, the sense of self, the way that they think about relationships as a whole, and they start to generalize and start to become very fearful of, being vulnerable or opening up or loving, right? So that can be acute, but it can also become chronic if maybe they have a bad relationship after a bad relationship after a bad relationship, right? And then we also, start to see people withdrawing, right? People withdrawing from friends, from family, just because they want to avoid maybe the questions of like, oh, where is so and so, or how are things with your significant other? And then there's that shame and guilt that maybe takes over that person. So they withdraw and they don't want to engage in those things. And in the long term, it can look like avoidance, right? Like not driving through a certain street because it has painful reminders, not going to certain restaurants, to the point that maybe not eating certain foods that they used to share with this person, right? So then it becomes really an isolating event. And with that comes a lot of somatic symptomology, right? We see a lot of headache. We see a lot of tension in the neck. We see back pain. We see migraine. So again, it might be one incident, right? One bad breakup, one bad friendship, and it has like a ripple effect throughout your life.
Yeah. Oh, that's such a great way to explain it. Because the ripple effect sometimes becomes cumulative, doesn't it? It depends on the event, and then it really can become cumulative. So, what about key symptoms? We talked about some somatic experiences that you've seen, but when somebody thinks to themselves, I wonder if I'm experiencing trauma. I wonder what the signs are that I'm experiencing trauma. In your experience.
Yeah, so a lot of the complaints are feeling withdrawn, feeling guilty, feeling shame about the situation or the event itself, right? A lot of self blame, a lot of negative cognitions about themselves, like maybe I'm not good enough. I should have done more. I should have stepped up for myself, right? And this becomes very pervasive, especially when we're talking about complex trauma, right? That is like compounded, event after event in early stages of your life, right? So then that kind of becomes a belief system that you're not good enough, right? As a whole, not just on a particular event. So those are the complaints that I see a lot when people, come to see me. And I think that it's important to point out that most of the time, folks are not identifying these symptoms with trauma, right? They are just identifying the symptoms as like, I feel weird, like I don't feel like myself and I don't know how to get out of this, right? So then when you start to have a conversation with them, when you start to get into, some of the psychoeducation of it, then it like becomes like a light bulb. And in that specific moment, that you have given them answers to some of the questions that they might had for a very long time. And just by the person being able to identify these, I might have been in a traumatic event, it kind of takes a lot of the power away from it because now they're going to be able to identify it, why they're behaving a certain way or why they're having certain thoughts.
Wow. Oh, that is so beautifully said, Lorencita. And it's the what I usually say is it's the what happened to you, right? It's not the what's wrong with you. It's the what actually happened to you regarding your experience and that aha moment or the light bulb moment that you're speaking about. It does happen a lot in trauma work. It takes maybe a little while to get to that point.
Yeah.
But it brings so much relief to people who have experienced trauma.
Yes. And it's the same, with other mental health issues, depression, anxiety, when you're able to tell that person, like, these are some of the symptomology of depression, of anxiety. They're like, I have an answer for it, right? I am not crazy, right? There is a reason why I'm feeling the way I am or why I react the way I do.
Yes, the why am I reacting the way I do? And then I work with children and teens and adolescents as well. And so that's actually my next question regarding how can trauma manifest differently with children and teens, so under 18s?
Yeah, so for children, we see a lot of like regression in their developmental stages, right? So toddlers that are fully potty trained, maybe they start again wetting their pants or, wetting their beds at night, or a lot of the defiant behaviors, right? Like some aggression. So that's some of the things that maybe to look out for that can be, related to trauma. And we have to take into consideration that for, toddlers, like for little kids, trauma can be as little for us as, someone taking their toy in the playground, right? And not having the capacity to kind of embody that and say, okay, we can take turns, right? I mean, you and I can say that and can rationalize that, but for a little kid might be really, really hard and feel really flooded and overwhelmed by these emotions, and they become reactive, right? So that's something to look out for. For teenagers, being a teenager, it's already traumatic, right? In a way, right? Like, you don't know who you are, you don't know what you want, you need validation, but yet you want alone time, like all these things, right? So a lot of the things that we might see in teenagers are what you withdrawing from. I mean, they're already gonna withdraw from family members, right? Because, right? But withdrawing from their friend circles, withdrawing from doing activities that they might have found pleasure in before, like music lessons, any sports that maybe they played or something like that, right? So those are the things that we want to look out for. And also we have to be kind of on the lookout for teenagers because they can be pretty secretive, right? And right now with social media, with AI and all these things, they are kind of more vulnerable to being taken advantage of. And that can lead to trauma, right? If parents or caregivers don't have that connection and being able to talk to their teenagers, it can have devastating impact.
You're absolutely right. In my experience working with teens and families, sometimes teens don't feel safe enough, right, in their family system to be able to share. So they ask to come to a counselor. And our role is to be able to kind of normalize that experience and their symptoms and what they're experiencing and try and find a way to kind of help the family move through whatever they have experienced, which is always hard. It's always hard. But there's a range of different traumatic experiences that people can go through. And I loved what you said about the individualization piece, because two people can go through the same experience and one can be traumatized and the other one may not be, right? It's not about strength. It's not about resilience. It's about the way that the brain is compartmentalizing or processing or not the experience that they've been through. There's a lot that goes into it. It's very, very complex as well. I'm wondering about personal stories or maybe examples that you feel comfortable to share from your practice where you have helped support a client overcome trauma.
Yeah. So again, this is my specialty. So I kind of work with folks that have experienced trauma on a daily basis. So a person that comes to mind is an older gentleman. He, like in his 70s, he was a Vietnam vet, right? And we know that when folks were coming back from Vietnam, there wasn't the support in place for them. And PTSD, trauma was not discussed. It was referred to as shell shock, right? And then kind of started to evolve. But so this gentleman, he is 74 years old and he is a Vietnam vet, and he has experienced PTSD since he came back. So since the 70s and 80s, right? And his symptoms are, to the T, what criteria for PTSD, like lack of sleep. It's been more than 6 months. Obviously, it's been like 40 years, right? Lack of sleep, withdrawing from family members, some drug use when he was younger. And right now, he kind of finds himself in this space of looking to, his short-term future and how he wants that to look like for his family, for his grandkids, all of that, right? So one of his main complaints was inability to sleep, right? And we know that if we are not able to sleep, sleep is kind of the base of it all, right? If you are not getting good sleep, you're not rested. If you're not rested, you are kind of your mind is racing or you're overly tired and kind of checked out, right? So what I started to do is, I started with neurofeedback, explain neurofeedback, hooked him up to the electrodes and for him to play the game. And he was really good at it, right? He was really getting into it. He was getting the feedback that the machine gives you, which are beeps. And every time you get a beep, then he play a game that it's kind of a puzzle. So every time he gets a beep, like the image starts to come to life, right? So every time you get a beep, it's because you're hitting all of the waves at a certain way that is calming your body, right? So that's the feedback that he's getting. So he got really good at it. So we did that for a couple of sessions, and then we started to really dig into having him identify some targets to process with EMDR. And we started to do that. It was really hard. He didn't want to, which is totally fine, right? We also have to be really mindful that when we ask someone to work on trauma, we are asking him to potentially get rid of something that they are so familiar with, right? Like they know how to take care of themselves within the context of living with their trauma and their symptomology and how they have created their life so it works for them, right? But it works just for them, right? So maybe isolating people that they care about, right? So he started to sleep better, and that threw him off a lot, right? Because this is new for him. It's been so many years since he has not been able to sleep without a night terror, right? So then that was the first thing that we started to notice. It was his quality of sleep. And so then we had to pause and do a lot of psychoeducation about this is different. And while it's different, you might be really resistant to it because you still don't know how to live without the nightmares, right? So we go really, really slow because this process can be hard, right? I can tell someone with depression, like, you don't have to feel this way. And they're like, I don't know how to act without this defining me, right? So again, trauma treatment takes a lot of time. So I also tell some of the folks that I work with that you took the first step that was getting into this office, and that it is so hard, right? To recognize that you want and need help and you are willing to tell me, a stranger, what's going on with you, right? And if I need to tell you, you don't have to live this way, and it took 30 years for you to get into this office. So we need to be really realistic that it's not going to take 2 weeks for you to start to feel better, right? It's going to take a long time. And the first step is you're here, and then we'll just go from there.
Thank you so much, Lorencita, for highlighting the courageousness that it takes for somebody who has experienced trauma or who's going through any other mental health issue to be able to reach out for support and gain help. It can be extremely daunting because they've lived with it for so long or they're not sure how to process it. So it really is a courageous act to reach out and gain support. And I know, you've worked with trauma for a long time. I have too at this point, but what was some of your most challenging cases that you've encountered and how did you approach them?
At the beginning of my career, and I was working with children and families and a lot of children in the foster care system, right? So there's a lot of trauma for these little ones. So I found that to be really, really hard because, they're little and vulnerable, right? And they have experienced, things that most adults will never experience, right? So I found that to be really, really hard for me. And at the same time, EMDR is so great with working with little kids. Little kids' brain is, you know, it's got more neuroplasticity than adult brains, right? So they are able to process things a little bit faster, right? So again, with EMDR in children, it's a lot of play, right? So we got finger puppets, we have coloring, we have storytelling, we have all of these tools that we can integrate to get them to process and to not start to store those negative cognitions about themselves, because those cognitions become maladaptive and then they can become intrusive later on.
Yeah, that's the piece, the intrusive part of it. It really, really can be very overwhelming and debilitating. I think that's the word that I'm looking for. And I know you've mentioned EMDR, I love EMDR, and then neurofeedback as well. So are those the two modalities, let's say, that you use mostly for trauma treatment? And then if so, how does it work? Like, why is it effective? And you could talk about both of them or one, but why does it work? How does it work?
So yeah, EMDR and neurofeedback are the two modalities that I use in my practice. I've started to dab into polyvagal theory as well, but that's not a specialty of mine, but it's got great resourcing. So EMDR is eye movement desensitization and reprocessing, right? So the basics of it is like there was an event that caused significant impact in your life, right? So that event is associated with maladaptive cognition. So a negative thought about yourself. So for example, if we go back to relationship, right? Like the breakup happened, it was terrible, you were unprepared for it. So the cognition or the thought that you start to have about yourself is, I'm not good enough. I'm not good enough to be in a relationship. I'm not good enough. Maybe if I would have done A, B, and C, this person would have stayed, you know? So the second guessing. So then there is the negative cognition associated with that event. And then having the person identify a more adaptive cognition, right? So a more adaptive cognition in this particular incident can be, we just didn't connect anymore, right? We, like people fall out of love a lot of times, right? Or we were just not on the same page anymore, right? So that's a more adaptive cognition than I'm not lovable, or I'm not good enough, or no one's going to love me ever, right? So when we have the event, we have the negative cognition and the positive cognition. And what we want to do is we want to strengthen the positive cognition, right? And to do that, we use bilateral stimulation. So it can be like this. So someone just follow your fingers, right? Or myself, I use what we call tappers. So people hold them in their hands and they vibrate from one side to the next. There are light bars. I mean, you name it. There are many, many things that people can do to achieve the bilateral stimulation. So the bilateral stimulation, what it does is like activates both sides of the brain, right? So we have our left and we have our right. We have emotions and then we have rational thoughts, right? So sometimes we are stuck in emotional brain, right? And all we can see is the emotion and the terribleness of the event. But then we're not tapping into a rational brain, right? So the goal is to allow those sides to connect and connect by creating new pathways, right? Two things can be true at a time. I can feel terrible about what happened and how things went down. And I can also recognize that maybe it was the best thing and the best decision that I could have made, right? Even though it was hard, right? So we're bringing emotion and we're bringing a rational part instead of like being stuck in one side or the other. So we're kind of connecting that. And that takes time, right? Again, like I said earlier, you might have been thinking about this for a very long time. And here you are ready to process and better understand why you're having some of the reactions or the fears of getting into a relationship or going to school, taking a test, whatever it might be. So that is kind of a bit of EMDR. And then neurofeedback, it's a bit more complex. So neurofeedback requires, reading of the electrical waves. So we have beta, theta, and other waves, right? So we have the fast moving, we have slow moving, and then we have the optimal ones, right? So I put electrodes depending. So I give like a little questionnaire, because there's different protocols for different, for anxiety. So you're creating a lot of high waves. So we want to like slow it down just a little bit. Or we have for depression, you're producing a lot of slow waves. So we have to bring them up a little bit, right? And for PTSD, like there's a combination. Sometimes you're producing a lot of high moving waves or slow waves, right? Because it goes back and forth. So we want the brain to kind of optimize and find that spot that makes your body and mind feel relaxed and you concentrate, right? And that's what we do with neurofeedback. So neurofeedback is, we also call it like training, right? So like, think about it as, you're going to the gym, right? And your goal is to have abs, right? It's not going to happen in a week of you going to the gym and doing things, right? It's going to take it's a process. You're training your body. You're introducing something to your body. So then the more that you do it, likelihood is that you will get results. So it's the same with neurofeedback. So eventually you have taught your brain what is that you need to feel calm and concentrate. So that's neurofeedback.
I love it. I love it. I could geek out on this, Lorencita. Thank you so much. I have not personally participated in neurofeedback, but I have experienced EMDR as a client before. And I have been through the training and everything, but I think for me personally, it was life-changing. EMDR really, really helped me overcome some experiences that I'd had in the past. And so I am a big proponent of EMDR, Shapiro's work. I just absolutely love it.
Absolutely. I myself have done EMDR and neurofeedback, right? And there's no shame in it, right? Also helped me tremendously when I did my own EMDR treatment. Absolutely.
And because trauma deeply affects individuals' lives. And I think that, if we can normalize treatment the best we can, more people are more likely to ask for help when terrible things happen, which terrible things do.
So terrible things do happen. And for us as mental health providers, I think it's on us to help destigmatize treatment of trauma and counseling as a whole, right? You don't have to be so depressed that you can't get out of your bed to seek treatment, right? Sometimes I call it see it like as a tune-up, right? Like you will go and you talk to someone, work can be stressful. Family life is stressful. The world is a stressful place to be in. So having someone that you can talk to, that that it's not going to judge you, it's only going to be beneficial for you and for your loved ones at the end of the day.
Yeah, and that's the piece. It's the effect of trauma, and gaining support and help can really remedy that and give give people options to kind of move through it, which I think is really, really important. It's an important point. What about steps that individuals can take to prevent trauma from deeply affecting their lives? Because I know self-care is a huge, huge part of the healing process of trauma. But really, what can people do to help themselves when we think about healing and self-care and moving forward?
A key thing that can be beneficial for a lot of folks is talking about it, right? Talking to a friend, talking to a loved one, not being it be a secret, not being ashamed of it, right? This is still part of who you are. And if you experience a traumatic event, this is still part of your history. It doesn't have to define who you are, right? Because sometimes we let adversities in our lives define who we are, and it doesn't have to be that way, right? So talk about it, be open about it. And when you're ready, you can have a consultation with a mental health provider. You don't have to engage in counseling, but you can kind of get an idea of what might it look like for you, right? So again, the way that I like to define it is like being brave and scared at the exact same time, right? Because you can be brave about talking about your adversity, and you can be really scared at the same time, and they're both valid.
So as we mentioned, self-care is super important in the process of healing from trauma. But what are your go-to practices, Lorencita, self-care practices that you suggest for your clients?
Right. So again, this is very individualistic, right? But if we go back and read The Body Keeps the Score by Dr. Bessel van der Kolk, he is a big advocate of physical activity, moving your body, because we know through his research that trauma does get stored in your body, right? So it doesn't have to be, like run a marathon every weekend, right? It can be go for a walk, go for a slow walk in a mindful kind of way. So what does that look like? Like you go out for a walk, maybe you're listening to a podcast, maybe you're not, and you're just really paying attention of what your surroundings look like, right? You're really paying attention to how you're breathing. You're paying attention to what are your thoughts doing, right? Recognizing, are they repetitive? Are they intrusive? Or are they kind of hopeful thinking, right? So moving your body is really important. However that looks like for you is important. Another thing that I mentioned earlier is sleep. Sleep is so essential for our well-being. If we're not sleeping well, if we are not hitting, again, people have different hours of sleep, 5 to 8 or more. If you are not having restful sleep, chances are that you're going to be grumpy and moody and sluggish, and again, prolonged exposure of insomnia can create higher levels of depressive symptoms, right? So sleep, exercise, eating as healthy as you can, right? Like we know that sometimes it is not doable to, eat all of the fruits and vegetables that you might, right? But again, making better choices wherever you can, it's going to be really important. So again, when a lot of people, when they talk about self-care, is about, go getting a massage or getting your nails done, get a facial, do all of these things. And some of these things are not accessible for everybody, right? So we need to be able to scale it back and say, okay, what is doable for you? Can you go on a walk a couple of times a week? Can you drink more water during the day? Can you try and kind of set aside and create this sleep hygiene for you at night, right? So there are multiple things that come into play when we talk about self-care.
So self-care is so important when we think about moving forward, healing. There are lots of different things we can do that are so simplistic. Even the smallest things can really help. Moving the body and going out for a walk, being present in the moment, and just being mindful of the tasks that you are tackling. I think that those small things can make all the difference.
And also being connected to friends, family, if that's an option, right? Because creating those pockets of community, it's also going to be so helpful in your self-esteem and not isolating, right? If you have a good friend that you haven't texted or you haven't called in a couple of days, if that person reaches out, like you already feel good, right? Like, oh, they were thinking about me. I'm not so irrelevant kind of thing, right? So again, creating those pockets of community is also really important.
Yeah. And, we're human beings. We're wired for connection. So it's an essential part of our makeup. We need connection. And I know, Bessel, you talked about The Body Keeps the Score. It's such a fantastic book. If you haven't read it and you want to know more about trauma, please pick up The Body Keeps the Score by Bessel van der Kolk. It is a classic text, and his research is really, really profound. But he talks about community, self-care, but social support as well. So I think you're really, really talking about something that's very important. I mean, it sounds like you feel that social support and the importance of community is really prevalent in trauma treatment, Lorencita.
Absolutely, because think about it. If you are someone who is struggling with trauma, and you isolate yourself, you are really cutting all of those connections and you're cutting all those people that might be able to tap into some of your strengths, right? So if you're cutting all of that out of your life, so it's just you, right? And we know, I said at the beginning, trauma overtakes your coping mechanisms, right? So if journaling, if listening to music, if watching funny movies is not helping, it's because you are not prepared. You are not prepared for the event that happened. Therefore, you try to put all these things in place and they're not working. It's because it's bigger, right? So that's where it becomes problematic if you are not able to recognize that I alone cannot do it.
Yeah, that's really, really well said. I love the way that you explained that concept. So thinking about the future of trauma treatment, Lorencita, what trends are you seeing in the field that are particularly promising? Are there any new treatments, approaches? You have a lot of trauma experience, a lot of intervention experience, but what's on the horizon that you're excited about?
Like I said earlier, polyvagal theory, polyvagal theory, it's been in place for a very long time, right? Just like EMDR was before it became huge, just like neurofeedback has been since it became kind of mainstream per se. But polyvagal, like the theory of polyvagal is really rooted in our body, right? In our biology, right? So being able to identify that and learn more about that and learning about our window of tolerance and, our social engagement, all of that is kind of, we're taking EMDR, we're taking neurofeedback, and then we're taking our biology and putting it all together, right? And I think that it's fascinating, something that I have pledged to learn more about as maybe integrating it into my treatment practices as well. So yeah, Polyvagal by Stephen Porges is really, really important not up and coming, but an important theory that's out there and on how to also engage in trauma treatment.
Thank you for sharing. It's those somatic techniques, right? When we're talking about a bottom-up approach versus a top-down approach. Not one's bad or worse than the other. It's just a different way of treating trauma. One of my favorite sayings is, I trained in psychodrama by Jacob L. Moreno, and I love psychodrama. It's very mind and body based. But he said this famous quote. He's the founder of psychodrama, and he said, the body remembers what the mind forgets.
Absolutely.
How brilliant our brains are, that when we go through something that is traumatic or is very difficult for us to be able to comprehend or process, it doesn't just go away. Our brain, kind of has to send it somewhere else, and it usually goes to our body, right?
Absolutely. Yeah, I think that is a beautiful saying, right? Because our body is going to remember.
Well, I have just loved this conversation, Lorencita. Thank you so much for being here and sharing your expertise on Tea with the Experts. I'm wondering, before we wrap up, if you have any final thoughts or advice for listeners that might be struggling with past traumatic experiences, or maybe they're going through something that's difficult at this time.
My advice would be to be introspective and kind of put it out there for yourself, and then you can look at it and see, okay, can I do this alone, right? And the answer might be yes, and if the answer is no, then how can you be able to exercise vulnerability and putting yourself first and seeking the treatment that you want and need in order for your own well-being to go to the places that you always thought or imagined going to. And if I could just read something from Brené Brown, that I think that it's also brilliant. So just want to, from her Daring Leadership, is remember the words of wisdom of Joseph Campbell. The cave that you fear is to enter holds the treasure that you seek. Own the fear, find the cave, and write a new ending for yourself, for the people that you meant to serve and support, and for your culture. Choose the courage over comfort, choose whole hearts over armor, and choose the great adventure of being brave and afraid at the exact same time, right? So I think that kind of helps us summarize, we need to do this for us, and we need to do this for the people that we care for.
Wow, a beautiful, beautiful place to pause, Lorencita, finishing and wrapping up with Dr. Brené Brown herself. Thank you so much for being here. And listeners, thank you for joining us on this enlightening episode of Tea with the Experts. What is trauma? Please remember to subscribe and tune in for more conversations that aim to destigmatize mental health issues and foster a more compassionate world. Until next time, take care of yourselves and each other.
Thank you so much for having me.